We turn now to item 5 on the agenda, which is the NHS 5-year forward view. I will invite Simon to kick off on this and then to invite his colleagues to supplement it. Simon.
Thank you, Malcolm. So we've discussed this before, and I think as the paper sets out and Ian can develop, the point of this exercise is that there is, I think, a sense across the NHS and more broadly that people have been working incredibly hard under difficult circumstances for the last 4 or 5 years. Performance has held up, but there's a sense that actually that more of the same is not going to cut it for the next 5 years. And so actually there is an emerging consensus on a number of things that need to change. There are a set of things that are within the gift of this organisation and other NHS organisations. There are some that go much wider than that in terms of the relationship that we have with communities, with society, other parts of the economy. And so the purpose of this exercise is to identify some of those strategic choices under different scenarios, given that some of the variables are outside of our control, and to begin a conversation about what it would take to get the NHS onto a sustainable footing, but in a different kind of service, a different style of relationship with the people that we serve. So that's a conversation that's not just for us. We're doing it with many other partners. This is by no means going to be the final word on the topic. This is just a moment in time where, building on the work that's already done on the call to action, the local planning, the extensive public engagement that have been on other topics, and we will pivot to further conversations on the back of it. But I think to miss the opportunity for the NHS to speak as the NHS at this moment in the national debate on the future of health in this country would be a missed opportunity, and that's why therefore we are doing this. But I think we've got opportunity for a substantive conversation now. Ian, to the extent you want to put further framing around it, otherwise I think we should get into the debate as a board on how this is shaping up.
Ian, let's get into the debate.
Let's get into the debate.
The board as to how it's shaping up. Let me invite comments on the paper and also, of course, on Simon's introduction from members of the board. I start with Kieran and David and other hands are coming. Kieran, please.
Hugely important. It's back to my earlier thing about, the ratchet is tightening every year, and completely agree that we need to do some big things. So my plea would be, can we be direct? Can we be open? Can we be ambitious? The second one is, can we frame it about the health of the population rather than budgets and money? I know that kind of comes and is important and sets context, but actually it's what do we need to do? Because even without the austerity, we'd be having this problem, whether it's this year or next year or some other year as well. And my last one is how we affect the change. Because we've all read reports and attended conferences about coordination and integration and everything else. We know technically what the answer is. The issue is how do we get from here to there, and how do we bring organisations with us, and what does that mean for incentives and tariff and whatever. But for me, in that order, start with health and then work through and how on earth are we going to get there, rather than saying we have a financial problem we have to fix, and come at it that way. And I think we'll end up in a better place.
Do you want to respond?
No,
to
I'd say let's just have I think
yes.
that's absolutely right.
Yes, yeah. and clearly those have to be critical parts of the 5-year forward view, because it has to be, I think, a simple and clear document, but one which can demonstrate that we can get traction.
Yeah.
But also that some of the ambitions for it will be over quite long time scales, and the health of the population is clearly in that category.
It's realism, I
Yes.
think, for me. It's the realism of the problem, the realism of the solution, but also the realism of making change takes time, it takes resources, it takes capability, and wishing it into place won't make it happen. We have to think about that as rigorously as we think about the money.
But it's also the joining up not only with TDA and Monitor that we've been discussing earlier today, but also with Public Health England and other delivery agencies who can help us to cross a broader landscape. David.
Thank you, Malcolm. I think, first of all, there are some very big questions here, and clearly the answers will emerge over time and will probably change over time. I guess sort of what I'm really interested in terms of at the end of the day we'll have a solution, but it's what do I have to believe as to the extent to which that solution will work, because there will be a series of critical fundamental assumptions, and how are we going to test those assumptions and see that we can believe that the solution is the optimal one. I think the second question I would have is, what are we going to do differently to believe we can execute and actually implement the solution and make it work? Because without that, I think there are, we've all worked in organisations, myself many times, where actually the execution, the idea's been great, but the execution's been flawed, and actually therefore the initiative fails. So I think we should give as much effort to what we as NHS England need to believe and do differently, but also what does our broader system need to do in a way to give this the best chance of success. That then leads into clearly about what are our priorities, because these 15 questions that you've identified, I think there are 15, or Ian has identified, they're all material problems in their own right, and I think solving them all at one go is going to be challenging and heroic, and actually which are the 3 or 4 that we can pick off over what timetable and determine them. And then finally, my other question is, how can we create the right conditions where we will stick with it? Because the one thing that we also know about change is that it never works in a nice linear process with success at every sort of month and every quarter and every year. So how can we measure what we're doing, know that we're on track, and know that we can have confidence in the delivery? Now, some of those will come when the forward view gets turned into some sort of real work. But I think the first two about what we need to believe to execute, what are the fundamental assumptions, are ones that this board needs to stare at hard and get confidence about to be able to support the initiatives that are being suggested.
I have Victor and no. Victor.
Yeah, it's more of a build, I guess, on the less of a question. And it just strikes me that the process of this exercise, this forward view, has to match the intention to arrive at a different place than where we've been. So there's it's not a question. It's more how we intend to work with our other partners, other organisations in the health. But I think what would be different is if we were really clear about how we were going to work with the public in arriving at some of the solutions to the questions. Because I think that some of the questions there are answers for, but they're just not in the way we've always done them. So we need to find a way of getting some new voices, and we need to find a way of inverting the pyramid so that we're getting more of solutions from the front line, the middle, rather than just from the top. Otherwise, I think we will end up saying exactly the same thing to ourselves, but using slightly more sophisticated language.
Have Noel and Margaret.
Thank you, Malcolm. I thought there's an important link really yesterday between the public discussion at the AGM and the discussion we're having today and will have over the 5-year plan. And it struck me above all that in the mood in the room yesterday was fundamentally about we're all on the same side here. We're actually all on the same team. And particularly around sharing an ambition for the NHS, particularly around recognising that 1.3 million people come into work every day or every night setting out to do an excellent job. And thirdly, that there is a huge respect, a profound respect actually, for the brand of the NHS, possibly, based on the mood in the room yesterday, the most trusted brand in the UK. So there was a huge amount of agreement. What I felt from the room yesterday that perhaps needs to be carried forward as some golden threads into the 5-year plan was really around pace, and secondly around safety of the system. And I don't mean that in terms of patient safety, but more in terms of preserving some of the profound principles of the NHS. So my summary is that as we think through the 5-year forward view, would the executive recognise some of the important principles that have come from the mood yesterday, that being just one barometer of the mood of the public voice. Because I think co-creating the 5-year view is, in a sense, critical to preserving that philosophy that we are actually all on the same team here.
Converge quite well. Margaret.
I think building on David's point that we can't boil the ocean, so we need to decide on the priorities here. The 15 questions, key questions, are clearly all critical, but to me the one that has greatest importance is number 11. What's the true cost and value of the NHS to UK PLC? And it's not UK PLC, I would say, it's to UK population. Essentially, we've been seeing the NHS as a cost, and there is an enormous value in the NHS, and the work that needs to be done to underpin and understand that value is I think critical to understanding where the priorities, or how to prioritise those issues. And so I think my exhortation is that we actually give ourselves time and opportunity to look at the value, so that we can respond to criticisms or comments about the way in which we prioritise.
Thanks, Malcolm, and links to Margaret's point, but and also to a question that we were asked yesterday. I can't remember at which part of the day, but obviously we're working closely with the other parts of the NHS system, really. But again, people were asking, what do we do about benefit system? What do we do about education? And obviously the timescale for this is exceedingly tight. But is there any way in which some of those interfaces can be usefully identified in the forward view? The importance of getting those better, I think, would be how I would describe it.
Yes, can I just build a little bit, if I may, on Kieran's point? 65 years ago, the NHS was set up as a vision that was born of moral values and an emerging social conscience. And it's something that everybody, I think, in this country is proud of. And what we're seeing at the moment is an NHS which is struggling in some areas and creaking in others. And we are one of a number of guardians of that vision, whether it be the TDA, Monitor, other agencies. And the issue is that we, I think, retain the vision, but we are also guardians of the ambition. And the ambition has grown. The ambition has grown in a way that we now focus on improving quality in a continuous way and trying to get ourselves to the cutting edge. And I think Aradazi was absolutely instrumental in helping us focus on that vision. And also we have a deeper understanding of the issues of the physical and mental issues which relate to social inequalities within our society. So if we get that vision right, and if we get the choices right, we will help to not only contribute to individual well-being, but also to society and to the economy at large. And therefore, what I would endorse entirely what you said, that the issues here are ones of social conscience, if you like, of improvement of quality, of reduction in inequalities, where the financial considerations are simply a consequence of our guardianship of that ambition.
Are there any other observations to transmit to the team? I think we have around the table a pretty steady sense of realism about what we can achieve with the 5-year forward view. It's a unique step in the sense that it will be the first time that the NHS, comprising not just us but our partner arm's length bodies, will set out a view for what is possible and what is desirable for the NHS for the next 5 years. But it cannot be a detailed top-down strategic document determined from above. We live within a highly devolved system We are those who have responsibility for investing against the outcomes that we wish to achieve for the health of the population. And we are operating within a context of steadily rising demand along the lines that Kieran and Bruce have referred to, a relatively flat budgetary settlement, and a need to try to ensure that the changes that we advocate are realistic, are achievable, will get traction amongst the communities whose responsibility it is to provide those changes, and will be able also to, if not inspire, then at least convince, going right back to David's earlier point, convince those who have the operational responsibility that here is a way forward. So,
sorry, within that as well, it's always easier to sort of paddle with the flow of the river rather than against it. And one of the dominant trends is technology, the democratization of information, the use of data, the extent to which that can aid prevention. And I think we're all interested to see how we can capture that theme and use it in a way that helps maybe try and change the demand curve a bit, because we need to focus not just on the supply curve but also on the demand curve. And I think I'm interested in the interventions that we think around both of those, but as much on the demand as on the supply.
yes, and I mean, question 13. By the way, I decided not to go through the questions one by one because we would consume an enormous amount of time, but these are fundamental to the framing of the questions and also to the answers. And I agree with you. I think the bending of the curve of demand and the understanding of where technological change, not necessarily generated by us, but if not generated and if not accommodated by us, will start to transform the provision of healthcare across the world. And I think it's important that we're acknowledging that and incorporating it into our forward view for the next 5 years. Well, I think the... I'm sorry, John, I didn't see.
I just wanted to comment on that last point of absorbing technology. Before doing so, just to pick up Kieran's point about us getting older. My university has a leading interest in ageing, and it's worth remembering it isn't a linear sort of being carried to hell on a handcart, that we're just getting older and older and older and therefore the problems get bigger and bigger. It's a moving wave. The point at which we reach frailty is moving away from us, and so the fact that we're older doesn't necessarily mean we're sicker. And I think that that's got to be incorporated into our thinking, because it's sort of taken for granted if people are 5 years older than they were, that somehow is a bigger burden on the NHS. It does, however, put prevention into more focus, because we have more opportunity and more necessity to look after ourselves than we did before. And I think my main anxiety for the 5-year plan, being a geneticist, is 5 years isn't a very long time. And I think as we deploy these technologies, and we'll be talking at the next board meeting, I know, about genomics, so we're going to talk about that now, but obviously it's going to allow us to identify people at risk. The difficulty is they're at risk of diseases that come on 5, 10, 15, 20 years from now. We're telling them now that they're at risk, and indeed we want them to intervene, but that inevitably brings a burden to us because they want a mammogram or a colonoscope or things that will predict that disease. And I just wonder that I need to be reassured that the officers are keeping in mind that there will need to be an investment in order to gain that benefit. And the investment comes in this 5 years, the benefit comes in the next 5 years. And that's a challenge for us in a straitened economic period.
That's exactly what you said, Chairman, that I said that it's important that we look at the value, and that I couldn't endorse more highly what's just been said, because in essence what we're saying, for example, there is that the emphasis on prevention is so critical. Benefit of the corollary is going to be there, and that's why that work at the front end of understanding what the value is going to be really important.
But it also, sorry, it's just what you said is really important in the context of who is living with hunger. Because it's not everybody, is it? There are distinctions, depends on who you are, where you are, and how much you've got. So some of those preventative interventions are not about oscopies, they're actually about education, they're about engagement, they're about service design. So if anything, it emphasises the co-design of this 5-year forward view process as much as it does what you've pointed out. But I just think when we say make these statements about people living longer, we ought to almost immediately follow it up by saying which people, because it's not everybody.
Yes, Tim, sorry.
Just to provide, in a way, some reassurance, I mean, and I hope that the 5-4 view will reflect this, that in order to enable the future you've just described, which may and will be beyond 5-year horizons, we have to do some incredibly basic Bronze Age things in the health service. So we, at the moment, don't know who those people are. We haven't. There are hospitals that can't even count the number of people they treat for certain conditions. There are massive absences in our insight into actually what happens, and without that flow of data in one sense, we will be hopelessly failing to provide our patients with the kind of advantage that these new sciences offer. And I just really hope that in the 5-year-4G we lay down very clearly what the minimum set of preconditions we expect from those who wish to treat patients will be in relation to data and technology. And I think we have an obligation to do that, and that's something that has to happen within the next 5 years. That's not an optional extra. But just to reassure you that we're pretty focused on that.
I think these are all fantastic asks, some of which are mutually inconsistent. So we cannot actually focus while going wider, prioritise, publish next month, engage broadly, and look at 10 years, not just 5. So each of the asks is right in its own terms, but this particular piece of work that we're engaged in is not going to be able to do all of what we just talked about. So as long as we're all clear on that, it sets an agenda for us, but it won't be the final word. Then we'll be home and dry.
However, shall I say, it will be a high-level distillation of all the wisdom that has been injected into it today and will be injected into it by members of the board over the coming 3 or 4 weeks. I mean, of course it can't capture everything. And what we do not want is an encyclopedia of the future of the NHS cast in stone. What we want, actually, I think, is a high-level understanding of what is feasible, what's achievable over 5 years, and why people should believe it. And I think that's what the task. It's not a trivial task, but it's a critically important task. Ian, did you want to?
I just wanted to add that I don't think this is a 5-year plan.
No.
We will set out a direction of travel and some clear actions. But to pick up particularly on Victor's point, those actions will need lots of further design work. And that design work has to be with local NHS commissioners and providers, the public and patients, and indeed wider local communities. And so I think there will be, actually, the process after the forward view is more important than the words in the document itself.
Okay, I should just explain that there has been a great deal of engagement by the team with individual members of the board as the early thinking has developed, and we encourage that process to continue right through to the final publication, because it's something which every member of the board wishes to own upon its publication and to join closely with the other arm's length bodies. Thank you very much for that, and good luck.